I will be telling about impressions in complete denture. Okay, impressions in complete denture according to Divan, ideal impression must be in the mind of the dentist before it is in his hand. So you must literally make the impression rather than take it. So whenever you make impression, like you should say making an impression, not taking an impression. So in detail about the primary impression, steps in complete. What are the steps in complete denture? First is, what step you do first? Making primary impression. So next step is clinical step I am asking. Next step is, what is the next step? Secondary impression. Next, jaw relation. Next, trying. Next, complete denture delivery. Right? Secondary impression. Secondary impression means where you will be covering with even border molding also. Okay, border molding, then making secondary impression. Complete denture impression is a negative registration of the entire denture bearing areas and stabilizing and border seal areas present in the edentulous mouth. This is by GPT-7. And depending on the purpose of impression making, the impressions are classified into diagnostic impression, primary impression, and secondary impression. So what do you mean by diagnostic impression? It is meant for diagnosis purpose or study purpose. It's a negative replica of oral tissue used to prepare a diagnostic cast. So once you make primary impression, you pour the cast, and the cast you obtained is diagnostic cast. It's also called primary cast or diagnostic cast. And it is used for study purposes like measuring the undercuts, locating the path of insertion, performing the mock surgeries, and is made as a part of treatment plan, and to estimate the amount of pre-prosthetic surgery. Also helps in articulating the cast on tentative jaw relation and evaluating the interarch space. So diagnostic cast is nothing but, it is also for similar to that of primary cast, but here the uses are different, where it is used for diagnosis purpose. So what do you mean by primary impression? It is an impression made for the purpose of diagnosis or for the construction of the special tray. So what are the materials we use for primary impression? What material you use? Impression, mainly impression compound and arginate. Okay, even arginate you use, even impression plaster. Okay, even impression plaster also can be used usually for, it is type 1 gypsum. When you want to make mucostatic impression, you go for either arginate or your impression plaster. What is mucostatic impression? So as I told you, they are depending on the purpose, it may be diagnosis, primary or secondary. And based on the theories, it is classified into mucostatic, minimal pressure or mucostatic, then mucocompressive and selective. Okay, three theory. Based on the theories, it is mucostatic, mucocompressive and selective pressure technique. What are the primary impression? You use impression compound regularly in the clinics. So it should record complete sulcus depth and sulcus width along the entire peripheral area, and anatomical landmark which indicates the correct extension of the special tray, which it should include maxillary tuberosity as well as the retromolar pad for mandible. So an accurate primary impression, it should record all the anatomical landmarks that should be covered by your impression, and it should be obtained in the denture. The primary impression should be taken in stock tray. Usually will be taken in stock tray, right? So if it is usually edentulous impressions are made of which type of stock tray? Which type of stock tray is used for making edentulous impression? Which type of stock tray? For impression compound, you use metal stock trays. Whereas for when you are using alginate, you use perforated metal. Okay, perforated trays. Whereas for your impression compound, you use non-perforated metal trays. Okay, you can see here there are two types of trays: perforated and non-perforated trays. Perforated trays are used when you are using alginate material for making primary impression, and these non-perforated trays are used when you are using impression compound as a primary impression material. And ideal features for stock trays or preliminary trays should be: the tray should be rigid, it should be easily modified, compatible with the material, comfort in oral environment, and ability to be sterilized. Okay, and there should be at least 2 to 3 mm clearance between the stock tray and the ridge. So this is all about the primary impression. So when you are making primary impression, especially with the impression compound, there should be space of around 2 to 3 mm, okay, between the tissue and the tray area. Okay, and it should be, as I told you, there are some features that has to be you have to have in your impression. Like it should be completely covered till the sulcus area, and all the anatomical landmarks to be covered in the impression. Okay, and the edges of the sulcus area to be well refined and rounded. It should not be sharp edge or it should not be bulky. Okay, these things should not be there in the primary impression. So the manipulation of impression compound, as you all know, right? So what is the fusion temperature or the glass transition temperature, and how it is needed. So these things I think you have already come across in second year. So I am not going in detail about it anyways. So when it comes to the secondary impression, once you do with the primary impression, what you do? You do beading and boxing for the primary impression. Then pour the cast with the plaster. Then the cast what you obtained is, it is diagnostic or primary cast. Okay. Over the primary cast, what you do? You do special tray. Right. So how the special tray should be? It should not be going till the sulcus. Your special tray should be short of sulcus, 2 mm short from the sulcus. That is why it should be short. That is for doing border molding. You are providing the space for border molding. Okay, and you all know you are going for spacer first, then going for special tray. Okay, you know what is the purpose of placing the spacer, then doing special tray? Why you do spacer? See, spacers, depending on, there are so many different types of spacers available. Again, that is one different class for you. So I think you all have come across in second year already regarding the spacer, right? So when you are using, there are full spacer, I spacer, T spacer. Okay, depending on the patient's ridge, you are going to place the type of spacer, whichever is suited for the particular patient. That kind of spacer you are placing, then going ahead with your special tray. So once the special tray is done, next step is your secondary impression. So how the secondary impression is done? First, you are doing border molding. Okay, that in detail, anyways, will see now. So the secondary impression is done to record the denture bearing area in great details. You have already recorded, but in greater depth, it is done in secondary impression. And record the muscular peripheral tissues in function. So you should ask the patient to do some function, then you are going to record the impression in secondary impression. So the impression here used is ZOE. So before going for impression, first you do border molding, then go for secondary impression. So going in detail about the border molding, let's see what are the different materials used for tray first, special tray. So there are, you can use thermoplastic resin, shellac, autopolymerizing resins, and light cure resins, and even ideal features of custom tray is it should adapt well to the primary cast. It should have good stability, rigidity, proper extension to cover the basal seat, and ease of modification and manipulation. And it should not wrap and consistently relieved approximation of vestibular tissue, not react with impression material, and it should have a smooth margins. So going in detail about your trays, I think you have come across in second year already regarding the trays. So to tell you about this impression materials, what are the different impression materials? There are two types of impression materials here, rigid and non-rigid. In rigid comes the impression compound, impression plaster, and ZOE. Whereas non-rigid hydrocolloids, that is agar, reversible hydrocolloid, irreversible hydrocolloid, arginine, and elastomers, polysulfide, silicons, and polyether. So as I was telling, the impression is classified based on the purpose: primary impression, secondary impression, primary and secondary, diagnostic, primary and secondary. Whereas based on the theories of impression, it is classified into mucocompression theory, mucostatic theory, and selective pressure theory. And based on the position of the mouth, it may be open mouth or closed mouth. Usually, the conventional way of doing, like you make your impression in the patient mouth, and patient is opening mouth, that is said to be the open mouth impression. Whereas closed mouth impression, it is done by patient itself. You are not doing impression there. Okay, patient will be biting hard and closing and doing movements. So that in detail will tell you later stages anyways. So open mouth is the one which you do regularly. The closed mouth is where it is impression is recorded in relaxed condition and recorded in functional way, where it is under biting force and patient manipulate his tissues by closing, grimacing, sucking, and swallowing movement. Okay, first you do jaw relation. Okay, and don't do the vertical, only vertical jaw relation it should be done first. Then you should ask the patient to before making impression, mix the ZOE or whatever the secondary impression material you want to use. Then place it over the tray. If this denture base and ring acts like a tray now, okay, for closed mouth. So over the denture base, you can mix the material and place it in the tissue area and keep it in the patient mouth. And ask the patient to do all these movements like grimacing, sucking, swallowing, closing. Okay. So by that movement, all the areas will be molded.